So the BRUIN study is a phase I/II study of the non-covalent BTK inhibitor LOXO-305. And last year at the ASH meeting, we presented the earliest data as an oral presentation for this molecule in patients with relapsed refractory CLL and other lymphomas, just a small number of patients. But what got everybody's attention was how active this molecule was in a heavily pretreated patient population, many of whom had resistance mutations to covalent BTK inhibitors, such as ibrutinib or acalabrutinib. This year at the meeting, we're presenting a much larger, more robust data set in greater than 300 patients who either have had CLL, mantle cell lymphoma, or other B-cell malignancies. And the take-home from the molecule was a couple different things. Number one, incredibly well tolerated. In the presentation, you'll see the AE table looks unusually empty, and that's because of the fact that there were only 3 adverse events in total that occurred in more than 10% of patients when looking at all grades and all causality. And then digging a little deeper into adverse events of special interest, the typical BTK-associated adverse events like atrial fibrillation, bleeding, arthralgias, and others are extremely rare. AFib occurred in less than 1% of patients, and grade 3 hemorrhage, for example, the serious bleeding occurred in less than 1% of patients. So it was very well tolerated molecule. In terms of efficacy, even more impressive, we saw a high overall response rate that appeared to deepen significantly with time. So the follow-up is relatively short on the study, but for the numbers of patients who've been followed for like 6 or 8 or 10 months, we saw response rates that exceeded 70%, particularly in patients with CLL. And then, of course, response is one thing, but whether responses are durable are another. And we'll present the swimmer's plot that shows that nearly every patient with CLL who is responding continues on the molecule, and that responses do appear to be quite durable. The same is true in the waterfall plot that we present, where we can see very deep very high proportion of patients having deep nodal reductions. And so overall, the molecule does appear to be safe, well tolerated in patient population that have had between 3 and 4 median prior therapies. And then Michael Wang is presenting data on mantle cell lymphoma, which pretty much correspond to the data that I've mentioned on CLL. High overall response rate in a patient population for where there is really no standard of care available. And so we're all excited about this molecule. It's a phase I/II study, so still early in the process of its development. But I can tell you personally, having taken care of in excess of 50 patients on the trial, that it has really made a difference to my patients individually, many of whom didn't have options, were progressing, were sick, some of whom even thinking about hospice, and have really responded and come back very nicely to do very well. So an exciting presentation, and we're looking forward to next steps on the study, expanding the population further and starting to look at the molecule in combination.